heated debate arises. Immediately there is a hate speech, maybe especially the social media. It has become such a toxic platform. Like, people see a picture in isolation from somewhere and they start.
Today our guest is Dr. Nabiha Fatima, who is a PhD sociologist and currently a sociology instructor at LSE. Welcome to the show.
Thank you so much. Thank you for having me here. I'm really glad to see the entire setup and the effort the students are putting in.
Thank you so much. So to begin our discussion, first thing first, I would like to ask you, why do you think there is so much taboo regarding mental health issues in our society?
Okay, so basically, when we talk about mental health issues, so generally it's in a very isolated compartment. It is seen as something where people either are labeled, a typical word, pagal, and even if you look at the language discourse, so when we sometimes we want to taunt people, we tend to see things कि ये तो पागल है या इसका दिमाग खराब हो गया. So these are the elements which we can even see in our language discourse, in our everyday language. So when we talk to the people, when we discuss these things, it is emotional well-being or the emotional health of everyone, be it children, adult, old age people. This is something which is highly seen in a very insensitive way. So yes, that is why all the more reasons this is how we are socialized. We are socialized in a way where it is seen as a taboo topic. So people always fear that if we go to a psychiatrist or go to a psychologist or we seek counseling or any kind of help, we'll be labeled with the typical word, इसका दिमाग खराब हो गया या इसको emotional health issues हैं या maybe they're on drugs or maybe they're on something else. So these are the worst things which are, and above all, then we see that depression is also seen as isolation from religion or or a lack of faith, which is utterly not correct, because depression, it is not scientifically proven that it is due to disbalance of sometimes a few chemical disbalance in our mental chemistry as well. So yeah, these are.
So as you mentioned that people think religion से isolation है, इसलिए people are getting towards depression or something. So there is a very common tradition practice, especially in our society, that people they start taking it like आपको उस तरह का कोई issue है तो we take you to a certain Pir Baba, and what do you think, that is there any way they can treat you, and do you think there are certain limitations to this concept?
When we tend to taboo things, कि ये ऐसा इसलिए करे क्योंकि इस पे कुछ साया है या कुछ जिन आ गया है या कुछ हो गया, this is where we go wrong. And I think these are all cultural barriers. These are the things, these are the barriers, these are the reasons, that is why there is a lack of access to not only, by the way, the emotional and mental health, but also for the physical health issues as well. Most of the time women are not taken to medical centers and they are always taken to these kind of totke and all these things because they don't have the right access.
Yes, and exactly, I would like to highlight a very important point that you said, that it's basically about venting out. So either you go to a mental health practitioner for that, or maybe a Pir Baba. It's basically how you take it out and how you start accepting it, and then you the first stage is acceptance, and then after that you go for treatment. So is there anything that I've missed and you would like our audience to know about these issues that are prevalent in our society, and our society is quite ignorant to it?
What I see is that there is a severe lack of dialogue. Like if anyone wants to talk about something, so immediately a heated debate arises. Immediately there is a hate speech, maybe especially the social media. It has become such a toxic platform. Like people see a picture in isolation from somewhere and they start giving all kind of toxic comment, not even thinking twice that what kind of an impact it is having on the emotional health of the other person. So I think the barriers that society needs to overcome, it's becoming more sensitive and becoming more respectful. And that respect goes for everyone, even for a toddler. Like we need to learn to respect people. I think this is one thing which is maybe going to reduce the element of depression and then remove these cultural barriers and taboos. And I think a little bit of more sensitization on emotional well-being and emotional health, this is also going to help in breaking these taboos.
Thank you so much for your time, Dr. Nabiha, and I hope there was a lot our audience could learn from today's episode. We're grateful to you for giving us time.
Thank you so much. Thank you so much for inviting.
Thank you so much for tuning in, guys, today. I hope there was something in today's episode that you could learn. So, see you in the next episode. Till then, take care. Allah Hafiz.